Okay, so right now I'm going to review my physician's orders against the MAR. That will be my first check. Today I have a couple of orders from the physician, 2 IV fluids. The first is Zosyn, 3.375 grams in 100 milliliters of 0.9% sodium chloride to infuse over 4 hours every 8 hours. And the second is the primary fluid, which is 0.9% sodium chloride at 75 milliliters per hour. Okay, so my patient is Mr. Sweetheart, who is a 72-year-old man who presented into the emergency department with shortness of breath, a productive cough with green sputum, and generalized weakness. Mr. Sweetheart has a history of hypertension, COPD, Parkinson's, and is allergic to shellfish and sulfa. His admitting diagnosis is pneumonia. So I have already taken his vitals, everything is stable. And as I said before, the physician ordered 2 IV fluids. So right now, I'm going to go ahead and withdraw the meds, which I have already. Right here I have my normal saline 0.9% sodium chloride. So I'm going to make sure to look at the clarity, see if there's any precipitate, and also if there are any leaks, which there are not. And I just want to make sure that I have the correct medication against the MARS, 0.9% sodium chloride. Right, and my second is the Zosyn, 3.375 grams in 100 milliliters. So I have my 100 milliliter bag of Zosyn labeled. Also checking for precipitate or any leaks, which there are not, so that's great. Okay, so at this point, I also want to check the expiration date on both bags. So right here, it says the expiration date is September of 2020 and September of 2020, so they are both still current and not out of date. Now I want to write my calculations, which I already did. So for Zosyn, I'll be administering 3.375 grams in 100 milliliters of sodium chloride. So 100 milliliters divided by 4 hours is 25 milliliters per hour. So I'll be administering 25 milliliters per hour of Zosyn to my patient. And for my normal saline, the doctor ordered to administer this for 75 milliliters per hour, which is my primary fluid, and my Zosyn is my Piggyback, which is my secondary fluid. Okay. So at this point, I want to verify my calculations on Skyscape, make sure that both medications are compatible with one another, and that my calculations are correct. Okay, so for Zosyn, it says that for a normal adult, the medication should be administered over a span of 30 minutes every 6 hours. But in this case, Mr. Sweetheart does have hypertension, as the doctor mentioned. So we want to infuse it more slowly over a span of 4 hours every 8 hours. So this is beneficial to his situation, so we don't increase his hypertension by causing him to retain fluid. So we don't want to exacerbate it. Okay. So now, after checking Skyscape, I want to make sure that the meds are compatible, which they are, and now I want to prepare both medications. So I'm going to go ahead and wash my hands. At least 15 to 30 seconds. And I want to glove up before I prepare and spike my medications. Before I spike them, I want to make sure that both IV bags are clamped and locked so that the IV fluid doesn't run and flow out of the bag. I want to keep the entire solution as much as possible. So I'll start with my primary fluid. There are no leaks. I want to keep the port as well as the spike sterile and maintain sterile technique, making sure not to contaminate them. So here's my primary spike. And perform a twisting, turning motion. Make sure that it's clamped. Alright. And I can also begin to prime it here before I take it into my patient's room. So I can prime it in my patient's room. Right. Same with this. I want to make sure to maintain sterile technique and that the clamp is closed. Twist turning motion. Okay, great. And the clamp is closed. Alright, so at this point, I'll take both medications into Mr. Sweetheart's room, along with the MAR and the order. Alright, I'm going to provide privacy by closing the door. Hi, Mr. Sweetheart, how are you? Great. My name is Christy Martinez. I'll be your student nurse for today. Your physician ordered a couple of IV fluids for you. So the first is normal saline, 0.9% sodium chloride, and the second is Zosyn. Okay, have you ever had Zosyn before?
No, I don't believe I have.
Okay, so Zosyn is actually an antibiotic that's going to help treat your pneumonia. And so we'll be infusing it slowly because you do have hypertension. We want to make sure not to overload you with fluid and cause your blood pressure to go up. So that's why we'll be infusing it slowly, okay? Before I continue, do you have any allergies to medications or latex that I should know about?
I think I have an allergy to sulfur and shellfish.
Okay, great. That's good to know. Thank you so much, Mr. Sweetheart. I'm going to go ahead and wash my hands and then proceed really quickly. It won't take too long, okay?
Okay.
Okay, Mr. Sweetheart. Now, I do want to check your IV site, and also if you could just give me your full name and date of birth, please. All right, Bob Sweetheart. Beep. Okay. And let me glove up and look at your IV site. Have you been experiencing any pain in that site? Okay. 1 second. My hands are a little wet, so it's hard to get into the gloves, but I'll get it on. Okay. So right now I'm just going to check the IV site for any redness or swelling, inflammation, extravasation, or infiltration. So, I know they're big words, but just making sure that everything's okay. I'm just going to look at it. Doesn't look red. I'm also checking the temperature of the site. Well, it looks really good. So we want to keep it that way, okay? And so I'll also document that you're allergic to shellfish and sulfa. So right now I'm just going to prime my solutions, making sure to maintain sterile technique. I want to make sure that my primary solution is hanging lower than my secondary solution. So my primary is sodium chloride, normal saline, and my secondary is the Zosyn, which is the antibiotic, which will be hanging higher. Okay, so at this point, I want to maintain sterile technique and make sure to sanitize the site for at least 30 seconds before I connect it to the port, okay? Alright, and then this. And it's very important to maintain sterile technique while doing this. So for at least 30 seconds, clean it really well. So then I'll just attach both. Alright, great. So at this point, I just want to prime my tubing and make sure that both are flowing. I want to clamp it before I do. Make sure that it's dripping. Fill the chamber up halfway. This is for Zosyn. And then I'll slowly prime it, making sure that there are no bubbles and that my solution does not flow out. Okay, great. And then I'll clamp that back, and I'll do the same with my sodium chloride. So I'm going to clamp it, make sure that the chamber is dripping and that it's filled halfway, and unclamp it and make sure that it's flowing. Okay, great. So now I'm going to enter my values on the machine. I'll be infusing Zosyn at 25 milliliters per hour of a volume of 100. And again, we want this to infuse slowly, so 75 milliliters per hour for the normal saline, and 25 milliliters per hour with a solution of 100 for Zosyn. Alright, so there are no bubbles, and if there are, we'll just take them out. And then I'll unclamp both solutions. Make sure that they're both running. Okay, Mr. Sweetheart, everything's running. I hope that wasn't too long. I also want to let you know if you experience any confusion or headache, lethargy, or diarrhea, please let me know. Those are common side effects of Zosyn. And if you see any redness or it starts to become painful here or it's swelling, please let me know as soon as possible so I can come and assess you and take care of that, okay? Is there anything else I can do for you? Alright, great. So I'm just going to let you rest. Your call light is right here, and if you need anything, please call, okay? Thank you, Mr. Sweetheart. Alright, so I'm going to go document procedure. Making sure that I wash my hands. And also making sure that I met all 6 rights, so that I had the right patient, the right drug, which is Zosyn, the right route, IV, right time, which is now, right dosage, 25 milliliters per hour, and right documentation, which I'm about to do now. So I want to make sure to document the IV site, which was on Mr. Sweetheart's right arm, how he tolerated it, the appearance of the site, it was intact without redness, inflammation, or swelling. The date, the time, my initials, and that is all. So I just want to make sure to put that label on the tubing to let other nurses know who take care of Mr. Sweetheart the procedure that has been done so they can carry on with their care. Thank you.